Welcome to Healthcare du Jour, where we dish up and digest the latest in healthcare. For the next 30 minutes, sit back as we bring you insight, commentary, and discussion on trending topics to the table, all expertly served up by our host and his guests. Healthcare du Jour is brought to you by High Tech Answers and Healthcare Now Radio, part of the Answers Media Network, and is sponsored by the law offices of Myrick O'Connell. Now here is your host, Matt Fisher.
Welcome back, and thank you for joining as we dive into the hottest topics in healthcare. I'm your host, Matt Fisher. On the menu today is Eric Sullivan, Senior Vice President of Innovation and Data Strategies at Inovalon. Welcome, Eric.
Hey, welcome, Matt. Thanks.
It's great to have you on. Before we dive into our main topic of conversation today, would you like to give everyone a little bit more of an introduction in terms of who you are and what you do?
Sure. So again, I've been in the healthcare industry for about 30 years. Kind of started the first quarter of it on the clinical side, working in hospitals, and kind of in more on the delivery side in the last, call it, 20 or so plus years working on the payer data analytics side of the healthcare ecosystem. So kind of that's been the span of those 30 years. And I brought that to Inovalon and been here about 7 years, coming from roles such as leading, innovation analytics at United Healthcare, on our national team, and other similar roles at different health plans and entities. So here, my role really is to work with our partners or health systems and plans on strategies to leverage and maximize the value out of healthcare data, right? And so the topic of how AI fits into that is a nice fit. I'm not, in full transparency, Matt, I'm not an AI expert. I've built a nice and very sophisticated AI team here within my data strategies group, which helps us advance down this path.
No, that I think will be more than fine. As you just said, looking forward to talking about artificial intelligence with you today, and hopefully, kind of given what you just said, that you're not a full AI person, that'll help you be able to explain it better. Because as we move into that discussion about AI, can you explain a little bit more about in terms of how it actually works? Because I think there is a big distinction between the reality and what you end up hearing about in the popular press.
Yeah, and the way that I look at it is, I come from, with my background, obviously, in a very traditional analytics sense of, starting my career doing a lot of coding, and everything is very linear, and certainly everything, the analytics are all very much logic-based, if X, then Y, right? And so it kind of ignores the specificity of what you're actually analyzing at that moment and just grabs data points and treats them all the same effectively, right? That's kind of the traditional way to analyze. And, the moving from a logic-based model to, and you can use logic-based models for predictions, but again, the AI and machine learning and aspects of AI, take that further by creating algorithms that you train, right? So you train the algorithm off of tagged, and it's usually tagged by humans, right? Data and experience, and the algorithms can kind of almost like in a regression model, but much more intelligently work backwards from that known result or the tagged data and become smarter. The algorithm starts building strength, and ultimately creates a stronger and stronger algorithm off of more tagged training data, right? So it's all about creating a model that keeps learning off of the output it's creating or other known outputs and tag data, and feeding into that model and that algorithm more tag data just keeps making it stronger. And ultimately it results in a probability of something being a certain answer, right? It's either a 1.0 or some other value around a probability. But that's very different than a if X then Y, right? If it's raining, then the sky must be gray, versus putting all these attributes around the weather and other things around the humidity, and to ascertain the probability that it's actually raining out or the sky is gray. So I think it's just a really paradigm shift of how you look at analytics, frankly.
So kind of as you said, that the program is building and adapting based upon the information that's being fed into it. Is that being done through continuous tinkering with the code or the algorithm by the developers, or is it happening within the algorithm itself, or some combination of the two?
Yeah, I mean, I can speak to kind of how we look at it here in our innovation lab, which is it's both, right? It's both adding more and more training data, right? So as we deploy an algorithm or deploy a model to, let's say, a model that predicts patient falling risk, right? So the risk of a senior person from falling in a nursing home, right? Very important, but very tactical prediction, right? So we build a model around that based off of a certain amount of training data and outcomes data that was tagged, and we deployed it, and that results in more training data and more tag data, because then we check to see if those results panned out, and that feeds back in. But at the same time, kind of upstream, if you will, our developers, our computational linguistics and computer science folks are building better algorithms, right? They're learning from that, saying, hey, why did we miss that? And not just are they making the existing algorithms stronger, but they're finding more technological ways to advance that algorithm. So it's happening both downstream, feeding back to the machine, hence kind of machine learning, or in addition to making the machine stronger inherently through better algorithms. It really is on both sides, though.
And kind of thinking about it, as you're saying, leaving aside and strengthening the system that
right.
is, the external factor. The internal factor of taking the data. How important is the quality of the data, and how confident are we in in being able to obtain quality data and diversity of data to help with the development efforts?
I think I think the quality of the data is critical, right? So if you train, it's very inherent to just how humans operate, right? If you train off of bad information, if you punish your dog because you incorrectly thought the dog did something wrong, you're creating a bad training scenario, right? With only bad output. So it's not much different than the axiom of junk in, junk out. If you train a system, an algorithm off of bad training data, poorly tagged inputted data, then you're going to result in a poor algorithm. So it's inherently critical that the training data is as accurate as possible. And we've been testing that here, Matt. We have is kind of a scenario that played out. We have been medically or reviewing manually millions of medical records with trained nurses, right? And this is a nurse sitting in front of a 50-page medical record, says, okay, let me look at patient Matt, and let me look through here and find where on what page it has evidence that Matt has diabetes and kind of similar conditions and factors around that. And those nurses have kept for the last 7 years here have been capturing that information as data. Matt, this doctor, this visit on page 19, we found this word that it made us think he had diabetes, and et cetera. That's training data, right? So that's and whereas you could have, and we feel very comfortable training our algorithms on that type of information where a licensed professional has gone through and tagged information that we can then build almost regressive models off of. Very different than when people literally just throw in as much, kind of go back to the big data era from a few years back, where it's like just toss as much data in as you can and see what comes out on the other end. That sausage making concept, I think, can result in a lot of false positives or as well as false negatives, but a lot of noise, and it just doesn't help the overall system. So I think that upfront getting the right data is really going to be critical.
So kind of taking that point of, as you said, getting the right data, it seems like to some degree choosing what that right data is a little subjective. Would it be possible to have, unintentional biases, or hopefully not, but, the potential for purposeful biases coming through in the data that's presented to the system?
I think it is. I think the subconscious bias or the unintended bias is always going to be a possibility, and depending on what models you're building, training it. I make an assumption, and my business team makes the assumption that a certified coder, that documents, an example I gave you, is good training data. One could argue, well, I'm only saying it because they work for my company, and my definition of good may not be the same as someone else. So there is, in that case, there's bias just because those folks work for our team here, and I give them, a gold star, right? But it doesn't mean that I'm not biased in making that selection. This is good training data. And I think that that's really an interesting point, that you're going to have that. I think the key is testing it out, right? So I think the other side of AI and these machine learning type models is, understanding how good they are and testing it. And that helps you understand, did your underlying assumptions up front about what is good training data, were they flawed or not, right? So at the end of the day, you have to deploy it in some type of manner of testing, and maybe you're parallel testing it to another non-machine learning scenario, and evaluate the results and see which one did better. I mean, so at the end of the day, it's still going to require you to see how it worked. And I think, Matt, to your point, if there's bias that may have been harmful to producing a better model, that should come out in the end.
Yeah, so would you be able to expand a little bit upon that testing process? I think you give like a little bit of a sketch in terms of maybe one means of testing is to compare it to let's call it a human review of the same type of thing. But kind of what does that testing process actually look like?
And we do a lot of that here because we're the kind of AI or machine learning, I guess more specifically, that we're doing really looks at driving operational efficiency. So much manual work is done in the United States to collect information, to incorrectly or inefficiently engage with patients or providers. So one of the focus areas for our team, kind of in our applied innovation lab, is to replace current operational inefficiencies with better machine-driven processes, right? So in that case, we're taking an existing process that may have a couple different elements of human activity. In the case of a manually reading through a 50-page medical record looking for terminology is a very much real example. Well, can a machine do that faster and more accurately? So to make it real, Matt, and to answer your question directly, we do a ton of side-by-side testing where we take 1,000 charts and we give them to our best reviewers and say, hey, Joe and Nancy, review these medical records and document A, B, and C. And then we take those same charts and we run them through a couple different algorithms. Maybe it's a deep learning model, maybe it's an embedding type model, different types of machine learning models. And we're just going to old school comparing the results and seeing which ones found more faster, right? And which ones, or maybe found the same information but found it faster. So both are good. So it really is, at the end of the day, it's having machine versus machine or machine versus human in rather controlled testing environments. I would not say it's a randomized controlled trial by any stretch, and just comparing results. And if a machine can have the same results as a human, but do it in a fraction of the time, that's a win, right? Because then we can take those finite human resources and apply them to other important things.
That sounds very interesting. For those of you just joining, I'm talking with Eric Sullivan from Inovalon about artificial intelligence. And kind of picking up on something you just said, Eric, in terms of with your company, and I'm sure others as developers of the AI solutions, you're doing internal vetting, but as you said, it's not blinded research or clinical trial. Do you see the time coming when there will be that type of external independent type research around it, or is that something maybe that's not necessarily needed with AI?
I think that depends on where this goes. I think if you're talking about AI to replace operational tasks, then no, I don't think any type of RCT would be needed. When AI becomes part of the treatment decision making, kind of going to the concept of transparency and trust, right? So why, as you as a clinician, would you, if the machine is saying, give this pill to Matt based off of, what the physician or the nurse she'll ask herself, well, why should I trust the machine? I think you're going to need, and I know this is recurring, where they are doing more trials, especially when it gets into treatment, medication, or other types of treatment type applications of AI. People are going to expect to see more rigor in that validation step. Maybe it isn't a full-blown multi-month RCT, because I frankly think the world is moving away from that type of patience of waiting 2 years to find out the answer, but using more real-world data, more real-world kind of trials, quick trials to assess the output. Again, is it something that we feel enough confidence on to replace any clinician step? And that decision making is really an important thing to have trust in. And I think trust is the key. Even on the operational side, Matt, our reviewers, our clinical reviewers, need to trust the machine is doing the findings the right way. And so we have to give them evidence of that by kind of showing the results of our simple trials. So I think trust will be the key part of AI, Do you trust your car to drive hands-free? I mean, that's, it's all the same. That's using AI. It's real-time machine learning and AI within your car. You have to have a lot of trust to make sure that you're going to take your hands off of that steering wheel. So it's really no different versus giving someone a pill to treat their MS.
And to get that trust, I think you were just kind of touching on a little bit, but in terms of being able to understand where and how the decisions are being made and coming from, I've seen articles and other suggestions that that black box or the so-called black box, to be able to peer behind it and see the processes that drive the decision. How important is it, on a day-to-day or some other basis to be able to peel back those layers and see that, or is it that once you get the trust as you're describing in the process, that you get to the point where maybe you just understand that it's going to be running through the right mechanics to get to the answer, but you don't need to see, thinking back to the old geometry days of, having to do the proof and, show how you got from A to B in terms of an answer.
Yeah, I think that trust is going to continue to be important, but get more important the more AI starts taking over some of the traditional human steps of treatment or therapy. The question is how much can you share, right? So the underlying algorithms are not something that you can just physically share with a clinician and say, here is the neural network model, and here's how, that doesn't make sense. So the question is what level are you going to share, and what level, and how does that garner trust? Now, I think that being able to produce findings, produce results, and every day I get, as you probably get, I get all these news flashes of different applications of AI and what they've found. I think that helps. I don't think anyone's going to ever expect that the actual underlying analytic model is shared, but the conceptual model around how you train that program and kind of what the findings are. It's interesting though, even with that trust, even if you can get to that point, or when you get to that point, which, because AI is used today in different aspects of precision medicine and things like that, are leverage AI. I think that you still need to have some type of fail-safe kind of break the glass aspect of it, meaning that a clinician can always override the machine. So, again, having a computer produce a recommendation is not new in healthcare. Having a computer replace a clinician or specific actions is definitely not common, and so that's going to require trust and the ability for kind of the override at the end if the machine gets it wrong. Because it's all based on probability. At the end of the day, this is all based off of the probability of the answer being the right answer, or a treatment being appropriate, or the medication being appropriate. So it's not a black or white thing. It's a probability that this is the right approach.
Which, and I think, as you're saying, is the ability to override, and it really sounds like you're describing a complementary or a supplemental process as opposed to a replacement. And as I said, I definitely think that is what I was hearing. And I think that would seem, an appropriate path to go along, because, we've always had technological advancements that help benefit whatever activity, in this case, obviously medicine, is being explored. So it would seem natural that we'd want tools like these to help improve the quality and efficiency of what physicians and other players within the healthcare industry are doing.
I think you're right with that. The key would be is it's not, it's a continuous process, right? So AI and as my team is deployed here in a bunch of operational areas as well as some tactical kind of quasi-intervention areas, the model continually learns, but we're constantly evaluating the strength of the model. And it goes back to producing those findings of that back to the end user. So if it's a clinician, if it's a operations director, they just need to know that it's being evaluated, getting stronger, and know where the model's going to fail, right? Because there's always going to be edge cases, Matt, and so there has to be a way to treat those edge cases, to treat those outliers.
Yeah, no, I think that is very helpful and instructive to hear, which is, as you're saying that, it's going to always be an adaptive process and you're always going to be monitoring. I feel like to a large degree, and not wrongly, we've been having somewhat of a high level discussion. Are you able to provide some maybe specific concrete examples of where AI is already being used and is already assisting in healthcare?
I think the few areas that I know that there's obviously a lot of publicized areas around, where Google's using it for looking at radiology images, right? And so they're feeding in millions of tagged radiology images and the clinician findings, right? And that they've built very good, using TensorFlow, but really good models around visual AI. There's just been, kind of announcements of kind of the human voice AI that's being used now at the point of care to capture information. Our approach has been very much applying machine learning type technologies around two main areas. One, and just to be kind of very practical, real, is engaging patients. We've always looked at, from our company's perspective, if you're trying to engage a patient to get them to go to their provider to have their diabetes treated, as a very real and common example for us. We had logic models in place, right, that would tell us which patients and when to engage them and how to engage them, right, and what the messaging would be. And we have been working on and at different stages right now of deploying much more machine learning type models that are smarter with understanding those aspects of a patient. So it's not just the quality and the volume of data we're bringing in, but the model is being trained off of what actually worked. So we're looking at how we intervened with 1 million patients last year, and what the outcome was is that patient actually see their provider. Did their condition get worse? Did it get better? That's become a large volume of training data, and we're using AI right now to take that data and actually get smarter with how we are intervening, right? So we can't use a vanilla approach or a logic model when patients have so many other things that influence their decisions. So that's a very practical and a weeds example that we are heads down on right now, is getting smarter with how we engage patients to get treated for the care they need. Another one is just a very tactical operational thing of replacing human clinical reviews of medical records with machines, and we launched that about 3 years ago. And really aligning with our entire conversation, that model continues to get better. We continue to add in or expand the type of algorithms as well as the volume of training data. And we've seen in our most recent side-by-side study, we were able to find roughly the same, or north of 95% of all the same findings that our best clinical reviewers found in about less than half, so about 40% of the time. So we are, again, the machine is acting as, almost as good as the best human reviewers in this very tactical operational model, but the machine is doing it in less than half the time. So it's a massive increase of efficiency for a company that's trying to do less with more. So I think that those are just, one's an operational, one's a very much engaging with the human, right? And how do you do that in the way that's much more intelligent? So moving away from pure logic models to models that can adapt much more quickly to the human behavior.
No, and I think those are some great examples and demonstrate that where real benefit can come in isn't necessarily the use or the concept that drives a headline in a newspaper or other news source, but is actually going to a real issue and helping with the delivery of care and helping to improve potential outcomes. But believe it or not, we're already out of time. So I want to thank my guest, Eric Sullivan, for a great conversation today.
Hey, Matt, thank you. And it was a great discussion, and appreciate it. And appreciate the time. But I think you're right. The importance is getting applied innovation, applied AI that can actually make a difference now, not in the future. So I think you're spot on.
Yeah, and thank you to everyone listening. Keep the dialogue going and connect with me at #HCDEJURE. I'm Matt Fisher. Until next time.